Deinstitutionalization did not occur in isolation. It arose from the historical context of mental health institutions that became widespread in the 19th century. Initially, these institutions were intended to provide care and treatment for individuals suffering from mental illnesses. However, the reality often entailed inhumane conditions, widespread overcrowding, and ineffective treatment methods. As psychological research progressed and new therapeutic models emerged, critics began to expose the inadequacies of this institutional framework. By the mid-20th century, a combination of advocacy for patient rights, public awareness, and evolving mental health theories catalyzed a movement toward deinstitutionalization. This shift sought to replace large, often neglectful institutions with more humane, community-based care models that prioritized patient dignity and informed treatment. The rationale for deinstitutionalization was rooted in several key advancements and growing societal trends. First, the development of psychiatric medications in the 1950s, such as antipsychotics, made it possible for many individuals with mental illnesses to manage their symptoms effectively outside institutional settings. Concurrently, public advocacy, fueled by human rights movements, raised awareness of the adverse conditions in mental health institutions and championed the transition to more compassionate care alternatives. This shift aimed not only to improve the quality of life for individuals with mental health issues but also to promote their social integration and participation within their communities. Proponents believed that community-based care would foster greater autonomy and dignity for patients, allowing them to lead fulfilling lives. Following the movement toward deinstitutionalization, the focus shifted to community-based care models that provided more holistic and integrated approaches to mental health. These models emphasized outpatient services, therapy, and support groups, aiming to address the needs of individuals within their communities rather than isolating them in institutions. The community care approach seeks to mitigate the stigma often associated with mental illnesses, creating an environment that fosters social inclusion. By promoting collaboration among healthcare providers, families, and local organizations, community-based programs facilitate comprehensive care that responds to individual needs while enhancing the overall support network for those with mental health challenges. This proactive approach represented a transformative shift in the perception and treatment of mental health conditions. One of the primary impacts of deinstitutionalization was the newfound autonomy and empowerment experienced by many individuals with mental health conditions. Patients who once lived within the confines of institutions now found themselves in a position to advocate for their needs and actively participate in their treatment decisions. Improved access to outpatient care allowed for more personalized and flexible support tailored to the unique circumstances of both patients and their families. However, despite these advancements, not all individuals thrived in community living. Some faced significant challenges in adapting to new environments, navigating social relationships, and accessing essential resources such as stable housing, employment opportunities, and ongoing mental health support. This duality reveals that while deinstitutionalization aimed for progress, it also highlighted the continuing need for comprehensive policies that truly support the needs of all patients. The deinstitutionalization movement brought numerous benefits and challenges that continue to shape the landscape of mental health care. On the positive side, there has been a significant reduction in the rates of institutionalization, reflecting a broader acceptance of mental health issues in society. Increased public awareness has led to more conversations and understanding of mental health, helping to reduce stigma. However, this shift has not been without challenges. Access to community resources has often been limited, and there are inconsistencies in the quality of care available to individuals in different regions. The need for a balance between fostering independence and ensuring adequate support systems is critical to improving patient outcomes. Recognizing and addressing these challenges remain an essential aspect of evolving mental health care in contemporary society. Looking ahead, the path forward in mental health care requires a concerted effort to integrate services across healthcare disciplines. To effectively address the complex needs of individuals with mental health conditions, collaboration between mental health services, primary care, and social services is essential. Policies must prioritize access to comprehensive support systems that encompass a wide range of services, from crisis intervention to long-term outpatient care. A crucial aspect of this integration involves continuous education and training of healthcare providers to ensure they are equipped to recognize and respond to mental health needs. Additionally, fostering community awareness and involvement can reinforce support networks, promoting a holistic approach to mental wellness that benefits individuals and society as a whole. In conclusion, the process of deinstitutionalization represented a transformative moment in the history of mental health care, shifting towards more person-centered and community-based approaches. This movement, while invaluable in providing opportunities for independence and integration into society, has also unveiled persistent gaps in care that must be addressed. Ongoing efforts to re-evaluate and refine mental health services are essential in creating an equitable support system that adequately meets the needs of all individuals. As we move forward, it will be crucial for policymakers, healthcare providers, and communities to collaborate in order to build a comprehensive mental health care framework that ensures accessibility, effectiveness, and dignity for every person living with mental health challenges.